Hi, everybody. Today's CuraCore Academy talk, also known as CAT Talk, is covering the big three. Those are the modalities, acupuncture, photomedicine, and movement therapy, that we can use for spinal cord injury patients to help them recover more quickly, more thoroughly, and possibly without surgery. Hi, this is Dr. Narda Robinson, and I'm going to talk to you today about facilitating recovery from spinal cord injury with medical acupuncture and related techniques from a translational medicine perspective. And yes, I am Dr. Narda Robinson, founder and CEO of CuraCore Vet and CuraCore Med. Our objectives and the rationale for my discussion are to develop a consistent and reliable approach to clinical problems that we'll see with spinal cord injury, and to institute protocols that match the mechanisms of injury and or disease with the mechanisms of healing of a given modality. So that's what we'll talk about in terms of how you can move forward clinically. And I'll be discussing mainly humans and dogs, but really that translational aspect from the canine clinical perspective and how that can help humans. So human spinal cord injury affects worldwide, probably well over 2.5 million humans at this point, with 1.4 million in North America, and many that have suffered traumatic spinal cord injury, and so they are under 30 years old. And there are hundreds of thousands of cases annually. These statistics are a bit outdated, but the treatment, including acute care hospitalization, rehabilitation, and lifetime medical costs, as well as their lost earnings, can amount to many millions of dollars. So in dogs, what we see is intervertebral disc disease as the most common spinal disorder in that species, and with many overrepresented in terms of breeds, the Dachshund, Bulldog, Corgi, Pug. So what we see is that we have a huge caseload of dogs with this naturally occurring condition of thoracolumbar disc disease and subsequent spinal cord injury. And clients are often willing to participate in these trials with a case accrual rate of around 90%, whether that's helping with the finances or they just want to help other dogs. And there's a lot of similarity between the gross and histopathologic lesions in the cord when you have this population and some types of human traumatic spinal cord injury. And the comparative complications of spinal cord injury in both species are really overlapping, whether it's the pain, inflammation, paresis or paralysis, cardiovascular, abdominal complications, incontinence of feces or urine, and then subsequent skin breakdown. Whereas surgery can cause clinically significant spinal instability, especially if you're going to go to levels above and below and disrupt that natural kind of tissue integrity that is holding things together in the spinal column. And when you have all this recurrence, then you risk causing people to think about euthanizing their animal, whether they say, we can't go through that again financially or because of what it did to the dog or whatever. So if we had other options for them, they could consider a non-surgical approach and really feel good about it, because we can see too, based on this report in 2012 in the Journal of the American Veterinary Medical Association, on the long-term neurologic outcome of hemilaminectomy and disc fenestration for dogs with thoracolumbar intervertebral disc herniation, that 15% are considered unsuccessful. And that's out of 831 dogs. And when we think about the long-term complications, that can include incontinence, permanent neurologic deterioration, and self-mutilation. And so even in dogs that have had surgery, these are conditions that we would love to treat, to get our hands on with medical acupuncture and related techniques, as well as integrative rehabilitation. But the clients hear from their surgeon that surgery is my only option. I feel powerless to question them. My GP said that, well, we could try high doses of steroids and keep her in a cage for 8 weeks, so enforced cage rest. That's not great either. We need movement. We need careful approaches with rehabilitation that can help the body relearn how to walk before or instead of being in a box for 6 to 8 weeks, going crazy, only being taken out for bathroom breaks, and having your functional connectivity get really weirded out as the nerves regrow or recover, and you just haven't been bearing weight, that the joints suffer, your patterning suffers, and then your mental state suffers. And so here, as we see with the American College of Veterinary Surgeons, that, as they say in pink here, surgical decompression of the spine by removal of the bone over the spinal canal is nearly always recommended. Well, that's their opinion. We tend to differ. The disc material will also resorb in some cases, whether we see this from the Korean Journal of Pain on lumbar herniated disc spontaneous regression, see that in people, and even MRI improvement, or in a dog here it was reported in JAVMA, spontaneous regression of lumbar Hansen type 1 disc extrusion detected with magnetic resonance imaging in a dog. And so even though if clients want to ask about acupuncture and laser therapy and rehab, sometimes they're told by the surgeon, no, don't do that. Wait until everything else is done, 8 weeks, 10 weeks, 12 weeks, or I don't believe in that or whatever. And they just don't know that there is science and there is evidence. And we can justify what we're doing, and we can take a rational scientific approach to it and make a big difference. And then humans may benefit too. So if we want to say who, when, what, where, and why, those are the questions that I'll be answering in this talk. Who, what species? Well, why not any species? Why wait? There's no reason to wait. It'll be a better outcome getting started right away. Which modalities? We'll talk about the big three: medical acupuncture, laser therapy, and therapeutic exercise. But I'm going to focus on medical acupuncture. And we'll talk about the points and my main protocol, so the medical acupuncture an integrated neuromodulation approach, where we focus on the central, peripheral, and autonomic nervous system points, as well as the myofascia. And that's just the system that I developed after the 15 years of writing my book, Interactive Medical Acupuncture Anatomy. That's a human atlas, weighs 7.5 pounds. But why? Because these are effective techniques. And so even if we're focused on a human, if I'm a human practitioner, because I'm an osteopathic physician and a veterinarian, but either way, most of the research on spinal cord injury and the treatments have been done on non-human animals. But isn't it great to have naturally occurring disease where it's not great to have the disease, but it's good to make use of that rather than induce experimental spinal cord injury, because that's not the same. And we'll look at that why. But here's the human literature: New England Journal of Medicine, recovery of overground walking after chronic motor complete spinal cord injury. And they're talking about epidural stimulation. And even, for almost 20 years now, 2004, epidural spinal cord stimulation facilitates recovery of functional walking following incomplete spinal cord injury. And just, oh boy, if you create inputs with electrical stimulation, the cord will respond. Well, we've known that for a really long time, those of us that have done medical acupuncture related techniques in dogs with spinal cord injury. Yes, improves outcome, improves conditioning. And you just want to pair that, though, with actual physical repatterning and strengthening as well. So those big three: acupuncture, laser therapy, and a thoughtful, tailored rehabilitation, therapeutic exercise, movement therapy approach. And then we get to, in nature medicine, neuromodulation of lumbosacral spinal networks enables independent stepping after complete paraplegia. Well, what are we talking about with medical acupuncture anyway? It's not chi, it's neuromodulation and it's connective tissue work. So giving appropriate stimulations to the brain, the spinal cord, the peripheral nerves, the autonomic nervous system, and the myofascia. And then we have canine studies, too, of dogs with intervertebral disc disease and how they improve, whether it's bee venom injection or electroacupuncture. Here from Joachim et al. In JAVMA 2010, comparison of decompressive surgery, electroacupuncture, and decompressive surgery, followed by electroacupuncture for the treatment of dogs with intervertebral disc disease with long-standing severe neurologic deficits. And a quote from there: electroacupuncture was more effective than decompressive surgery for recovery of ambulation and improvement in neurologic deficits in dogs with long-standing severe deficits attributable to thoracolumbar intervertebral disc disease. Hayashi et al. Reported in JAVMA 2007, evaluation of electroacupuncture treatment for thoracolumbar intervertebral disc disease in dogs. Quote, electroacupuncture combined with standard Western medical treatment was effective and resulted in shorter time to recover ambulation and deep pain perception than did use of Western treatment alone in dogs with signs of thoracolumbar intervertebral disc disease. So, and there are more studies too. These that I'm showing you are just select ones, but there's much more out there. And so if we want to think about the rational approach, why would we want to study the pathophysiology? Well, why wouldn't we? But we do want to know not only the pathophysiology, but the short and long-term changes. So the pathologic changes associated with primary disease differ from the secondary disease. And my approach to teaching and to practice is to match the mechanisms of healing of whatever modality I want to employ with the mechanisms of the disease process and the injury. So here in the primary phase, the injury is often unexpected, whether it's a dachshund that jumped off the couch or somebody that got in a car accident. Unexpected can last from hours to days or longer while the patients receive neurologic evaluation and treatment. So that's the primary phase. That's in the acute setting. In the secondary phase, that's where the secondary changes are going to start taking place. It can start early, but then it gets manifest as we go on. With the primary phase of injury, that's typically that mechanical jolt or the compression, the contusion, the lacerating, the shearing, or traction on those sensitive neurological elements. And this is my non-artist representation of the spinal cord and the meninges and the spinal arteries, as well as the segmental arteries that are feeding more of the tissue in intervals. And then if we look at a parasagittal section, then we see here the long neuronal, the axonal tracts. And as I say, it's just another walk in the park until some kind of injury occurs, whether it's compression from the outside or a disc material from that ventral or anterior aspect that leads to the mechanical compression and direct cell trauma. So the plan then, from my perspective, and how I like to approach it systematically, is to, as I said, match the mechanisms of the disease or injury with the mechanisms of healing, and to identify those clinically relevant benefits from medical acupuncture and photomedicine that will achieve those aims. Ultimately, what we want to do is improve the tissue milieu to support recovery, to cultivate new neurons and glia, and to promote that functional integration of those new nerve cells into the pre-existing neural tissue, and ideally to also prevent a scar from happening. And so we can also see what dogs can teach us in this regard. Again, those big three, the which modalities are medical acupuncture, photomedicine, using light as medicine to heal, and therapeutic exercise and movement therapy carefully done. If you'd like my references that I have for each of these steps, it takes a lot, so I've removed them from this talk because I didn't have that much time. But you can either email me at Narda, so Narda, Narda, at curacore.org, curacore.org, or here's the link where you can download it. You provide your email, we'll send you a link to download the paper. I think you also get signed up for our newsletter if you do it that way. So if you don't want that or you do want it, make your decision. You can email me directly or not. But this is a picture of the handout where it has the big three: medical acupuncture, photomedicine, and exercise, and how you can match the modalities of the injury with the modalities of healing. The link, for those of you that need me to read it out, the curacore.org/vet/ with dashes in between the big three modalities for SCI and / you can get it. So why wait? Well, addressing spinal cord pathophysiology in the early stages will promote better recovery, and we don't have to rush to surgery oftentimes. I mean, this is where we want to change the paradigm and change the ideas about what is gold standard, and we would like to have prospective randomized trials. But that's sometimes hard to do because people have to make the decision for their own animal of what they want. But anyway, start now. There's no reason to wait, and that might be shocking to some. So let's see where we can make a difference. I'm just going to give you some specifics, like I don't even know if those are still on the paper. I might have replaced them by now. But acute spinal cord injury, the major features that we want to match to modalities are, this doesn't change: orthostatic or systemic hypotension and spinal shock, vasospasm, potentially cell death from the direct insult of that mechanical interruption, and ischemia followed by edema. And then in the chronic phase, we're getting demyelination of those surviving axons, and that's not good, and that will continue. Apoptosis, so cell death, that continues on in from the acute and subacute into the chronic. We might get a central cavitation and a glial scar with the Syrinx formation, alteration of ion channels and receptors, regenerative processes where the neurons are trying to sprout, but if the glial scar comes in, then they can't get it together. And then altered neurocircuits where things are just firing haywire and you're not getting a good, meaningful, efficient reconnection there. And so when we look at all these different steps that happen with the acute and chronic phases and the primary and secondary pathophysiology, what I like to do is see, wow, that's where we could intervene with medical acupuncture and photobiomodulation, and to an extent therapeutic exercise and movement. Because there's this cascade of events that happens on the vascular, cellular, and biochemical nature that when you read about them, it's like, wow, that's something that I've read that these modalities can actually treat, which makes it way different than surgery or just sitting in a box for 8 weeks with steroids. There's actually really meaningful differences that we can institute to help thwart the long-term mobility and the greater extent of the damage and help the restorative processes. So initially there's hemorrhage, can't maybe do all that much with that, but with the vasospasm, we can do laser therapy and to an extent acupuncture to help relax those vessel walls. And this is just a study looking at cerebral blood flow with LEDs and then with acupuncture, intensive vasodilatation in the sciatic pain area after dry needling. So we can just see certain mechanisms we might have to extrapolate from either the brain or the periphery. But with ischemia and edema, a lot of those things are just generally impactable with if you're going to institute acupuncture and photomedicine and get system-wide effects. And here for edema of the cord, here's a study in Journal of Traditional Chinese Medicine in 2006, the effect of electroacupuncture at acupoints of the governor vessel on the aquaporin 4 channels in the rat with experimental spinal cord injury, which is not the same. Why it's nice with naturally occurring disease is it's coming more from that ventral aspect. You're not using a balloon or a weight on the spinal cord, and I have ethical problems with that as well. But this is how they're talking about inhibiting the edema of the spinal cord by electroacupuncture and decreasing the AQP, aquaporin 4 expression in those tissues. And then we have the inflammatory cell infiltration that's causing a whole bunch of problems, including the edema. And in this paper, Neurobiological Diseases, the acupuncture-mediated inhibition of inflammation facilitates significant functional recovery after spinal cord injury. So that's looking at acupuncture. Then you have all these mediators and pro-apoptotic signaling processes, and then cell necrosis. Is there some way we can change that? Is there some way we can manage the axonal disruption, and so the interruption of all those nerve pathways and the loss of myelination that will cause, further debility? And then the cystic cavitation, as we talked about, the fibroblast infiltration that's going to lay down other tissues, maybe that fibrous scar with the inhibitory proteoglycans that comes around there, leading to the astrogliosis and that gliosis and glioscar. And the little macrophages in the cord, the microglia, come around, and then you're a little bit stuck, and your attempts at remyelination are inhibited, and you get restricted axonal growth. So what can we do there? What about altered neurocircuitry and ion channels? Can we change that functional aspect of the circuits that are spared or that do regrow? And so for each of these processes, if you download that handout, I have an explanation of the mechanism that photomedicine and acupuncture and exercise to a degree will work to prevent that, because each of these steps are areas that we can intervene with these approaches versus surgery. You're done at that primary, impact phase. And then we get spinal cord windup. And so this excitotoxicity that's not good for the neurons. But again, acupuncture and photobiomodulation with the laser therapy and the LEDs can help to calm that down, unwind up the cord with those NMDA receptors and all in gear and everything. So really helpful, and we see the results, especially with dogs, and I'll show you some video at the end. So which points? Well, this main approach that I've developed, trademarked, medical acupuncture and integrative neuromodulation, again, it's the central point. So let me just get my little dog here. So for spinal cord injury, we're going to approach the points on the back, so on the bladder line and potentially the governor vessel line to an extent. But I like the bladder line more because there's more somatic afferents there. It's more rich and diverse in terms of the somatic afferent stimulation that we can impart with our dry needling, manual acupuncture, and then the electroacupuncture on top of it. The peripheral nerves we're going to talk about the nerves that are interrupted, where if we're getting paraplesis or quadriparesis or plegia, what nerves do we have to stimulate that follow the acupuncture channels to help restore communication with the brain and the spinal cord. The autonomic points that we can choose, like stomach 36 especially, has anti-inflammatory effects. That's going to help facilitate the whole regeneration, regaining of homeostasis and that whole system-wide anti-inflammatory effect. And then we have to also attend to the myofascia, all the restrictions that are developing because of the inability to bear weight appropriately. And then we can help stimulate and maintain the health of the tissue. So, as I said, central, peripheral, and autonomic nervous system points. Know the anatomy, then you know what they do, and the myofascial dysfunction that you feel and see becoming atrophied or whatever. And our little mnemonic is be accountable, accountant, CPA, be accountable to the myofascia. And so when we look at points to use on the back, we remember that there's the spinalis group medially and the longissimus group, that middle column there, and then the outer column is the iliocostalis group attaching to the ribs. And our governor vessel is coming down the midline. Our Huato Jiaji points are coming a half sewn off the midline into that spinalis muscle. And then the inner bladder line is coming through the longissimus and iliocostalis, that groove there. And then the outer bladder line is on the outer aspect of the iliocostalis muscle. And so whether it's a horse, a dog, a human, whatever it is, we're looking not only at the points, but really also at the whole network, a whole neurologic network, the myofascial network, the fascial network, the connective tissue, and how it integrates. So these human images are from my book, Interactive Medical Acupuncture Anatomy. So I've just here shown the outline of the bladder line there in blue. But I want to just reinforce that there's actually good anatomy underneath these channels, that when we see the bladder line coming here down the back of the leg, that here, so this is my multi-layered anatomy, and I had computer regenerated images of the virtual human, the visible human, and I got them to give me layers, and I placed the points on there, and then we saw how the points relate to the various structures underneath. So looking at bladder 36, 37, 38, 39, and 40, we see here, just removing the skin layer, that yes, there's one nerve to start out with, and that's the posterior femoral cutaneous nerve, that then dissipates, and we can see if we remove the hamstrings, that sciatic nerve coming from the lumbosacral plexus coming through the pelvis and then following that bladder line. It's no mysterious thing that the acupuncture points follow nerves and vessels and myofascial cleavage planes. That's what the Chinese were doing when they were developing their acupuncture system. And then you come down here towards the knee, and it divides into the fibular nerve and the tibial nerve. And so those are often what are impacted with spinal cord injury. And so if we understand that, whether it's the human or the dog in this case, and here are some anatomy images from Colorado State University, where I taught for 20 years at the vet school, that we can transpose those human points to the non-human and expect to see similar results in terms of that translational anatomy that we can make sense of now. And so when animals cannot stand, then we say, okay, is it sciatic involvement? Do we have femoral nerve involvement as well? And then we can use electroacupuncture stimulation. This is, the little Ito unit that we use in humans and non-humans. But we also want to consider the spinal segmental sources of those peripheral nerves. So that's the main approach, where we're thinking, okay, where do the nerves that were impacted, where do they begin? What spinal cord segments do we need to address to help with the nerve, and what spinal cord segments were injured? Then we help the nerve, we follow the nerve, distal points as well, and then we want to have an anti-inflammatory state and just restorative all over up to the brain. And so that's where we choose our autonomic points. So even for animals that are in a cart, there's often preservation, there's often stuff you can do. Even for animals that are deep pain negative, we can get that going. Oftentimes it's worth a try. So we want to reconnect what's not connected anymore, or not connected as well. Certainly if there's a full transection, that's not going to work, but that's not really what the problem is usually. Usually it's partial. And then we use distal points, the Bachie in the front if there was the cervical problem, or Bafeng in the back at the web spaces, and that's where the digital nerves come out. The metatarsal nerves will branch into the digital nerves, and that's a high traffic neural place. So here's a dog, couldn't walk, couldn't pee after surgery, and I'm doing some acupuncture, and his mom is holding a biscuit there. This is bloodhound's over 100 pounds. His 70-plus-year-old parents could not lift him up. He would have been euthanized if I couldn't get him walking again, which we did, and he lived several more years. When we talk about the acupuncture channels of the axial spine, we're going to say what points do we want to think about and why. So here's the governor vessel in the dog, and those points come between the spinous processes. Just here I've given you all the different interspinous process points. Those aren't all going to be transpositional governor vessel points. But essentially, that's where we're impacting. And the governor vessel, when you look at the actual rationale for these extra channels, extraordinary, curious meridians, whatever, it's really got a vascular basis. As Deke Kendall translated, they are singular vessels. So it's really vessels, actual vessels, and not mysteries, not spiritual pathways. It's actual vessels they were describing. So for the governor vessel, it includes the azygos and hemiazygos veins that drain the back, and a whole bunch of other venous pathways that follow that central nervous system and that midline. Here, just again from my book, from the cross sections, here's governor vessel 4 between L2 and L3 spinous processes, and we can look at those heavy epaxial and hypaxial muscles, and the spinal cord here is right in the center. It's actually becoming more the cauda equina at this point, all the little nerves in there. But when we think about what we're treating and why, we have acupuncture needles. So this was the individual before he was sliced up into 1 millimeter layers after he was euthanized after death row. This was that Visible Human project done at University of Colorado Medical Center. So he's on his back, and we can see, if you're thinking in the live individual, what are we stimulating as we implement acupuncture needles and laser? What fascia, skin, fascia, muscles, nerve pathways, etc., and what are the somatovisceral reflexes, all that. The Huata Jia G points are half sun off the midline. Those can often be good for tension in the back and relaxing some of those postural muscles, but if there's instability, we don't want to do too much of that. Joe Wong, MD, had created those facet joint points, or talked about them just over the facets. Those are 1 sun off the midline. If there's back pain, we might think about that. And then there's the bladder channel. And again, these dissections are from CSU, and I used to be there, and I worked with the anatomy department, but this is from their interactive virtual canine anatomy CD. And so we can see here these branches of the nerves coming along that bladder line, that inner bladder line. That's what we're impacting with acupuncture. There's the longissimus muscle, and out here is the iliocostalis, just lateral to it. So that's the inner bladder channel and the outer bladder channel, and there's just nerves everywhere that are taking in our stimulation. And here's just a drawing of the spinal nerve branches, not only on the back that we can think about, what we can think about on the side, the lateral branches, the ventral branches, based on what we need. So here's some nerves here poking through the fascia. If we have consequences for organ function, we can think about those back shu front move points, or the spinal segmental connections to internal organs. So we're not only treating the nerves, the nervous system, but we're actually helping with the organ function as well. And we can do that in the main approach too. So we can be thinking about what are the structures that we need to help recover. So the bones, is there any instability there? With spinal cord injury, there's often like an osteoporotic sequela. In humans anyway, it hasn't been described in dogs, but I don't think anybody was looking. Muscle wasting, the fascial restrictions, the vasculature. Remember, there's vasospasm and ischemia early on. We want the vessels to be giving good oxygen supply to the nerves and to all the other tissues. We're going to be addressing the joints in the back and in the limbs, as well as organs. And is there incontinence? Is there cardiovascular deconditioning? All those things. And implementing integrative rehabilitation as well, and massage. So I'm going to be just showing you some videos. This has some audio to it. Maybe I'll bring that down. But this is an old Welsh Springer Spaniel. And you can see, for those vets of you that know, you can see the ventral flexion of the cervical spine. and I wouldn't have had this dog on a leash like this. But we also look at hair coat. I have this whole system of how to see a dog and how to see a horse is under development, but how to see a cat as well. We look at hair coat changes and how the hair is often flat, where there's a lot of fascial restriction impacting the nerves that the piloerector muscles use to just have normal hair coat, but it's all just battened down. Those are often these transition areas that we want to treat, and it's just a big focus. So this dog probably has cervical intervertebral disc disease based on how the head is, how there's restricted movement there, and possibly also thoracolumbar disease. We'd have to do a neurologic exam. We're going to see if there's a little bit of toe dragging there, but the limbs are very straight. Could well be a caudal cervical myelopathy there. And this is a little dog, a Bichon mix. And look at that kyphosis and the stiffness of the neck, how much pain and debility that animal has. And these are from our acupuncture courses a few years ago. And we always want to see that animal move and what they can do. We never force a neck around into a painful position and make them scream, because we know where they're having problems based on our myofascial exam, very gentle, neurologic exam, very gentle, and just nice observation, not overdoing it for them. This is a dog. I'm actually going to take the sound down. I have this online as well on our CuraCore Vet YouTube channel, but this is an 11-and-a-half-year-old cocker. This was a patient of one of my graduates at Medical Acupuncture for Veterinarians course. Spinal cord injury, not surgical. Did acupuncture rehab, steroids, and gabapentin, and not cage rest. And Mo received weekly to biweekly acupuncture, and neurologic reflexes returning by the second acupuncture treatment, and then sensation that had been lost is back by the third acupuncture treatment, and then just continued with laser therapy and, that big three, rehab as well. So this is often what the dogs present with. They can't walk, they can't bear weight, they're just pulling themselves around by the thoracic limb, and then you do rapid, even if you can't get there right away, where there can be benefits later, but why wait? And then here, this dog did not have surgery, was no longer incontinent, and is getting around. Was not euthanized, had options, had a vet that understood the medical acupuncture rationale for this, and treated with the main approach. She's a graduate of mine, and look at the results. It's important to the whole family. Good recovery, no surgery. Essentially, just to start wrapping things up, why do we do this? Because it works. We can do neuromodulation, myofascial restoration, circulatory support, and activation of endogenous mechanisms, including endogenous stem cells that can be induced to differentiate into neural tissue. You don't necessarily need exogenous stem cells. We're doing that with acupuncture-related techniques, doing a scientifically based treatment approach, and something that can possibly benefit humans, because if you see what we're doing in veterinary medicine, there's a lot of lessons for human medicine as well. So thank you very much. Hopefully we'll have time for some questions. If we don't get to there when you're watching this, feel free to visit us at the website or info@curacore.org, or you can email me directly, Narda, Narda, @curacore.org. Thanks for listening, and I look forward to talking to you.